after a health disorder has been resolved, it's ideal to have a maintenance or prevention strategy in place. You want to minimize recurrence of the disorder if possible, and that is predicated on understanding at some at least hypothetical level why the disorder started in the first place. So because I find that 70 to 80% of patients with orthopedic disorders have joint derangements, meaning a joint has been tweaked, so to speak, and needs movement in a specific direction to fix it, our maintenance strategies can be quite specific. For those people, I often refer to a maintenance program as being either proactive or reactive. And I used to be a little bit more prescriptive when it came to these programs after discharging patients, but now I present it to patients in a large spectrum. I tell them, look, this is what happened to your joint. Here are some reasons why we think it happened. Usually an imbalance of forces on the joint throughout your lifestyle. For example, lots and lots of slouch sitting and never extending the spine. But if we can hypothesize as to why these things arise, then we can be proactive and attack those things so that we minimize the prevalence of it recurring. So for patients who want to be proactive, that can look like doing the specific exercise, the directional preference movement to their knee or their elbow or their neck on a regular basis. And again, there's a spectrum. For some people, that means doing it twice a day, and for some people that means doing it once a week. It really is being able to understand the influence of that movement coupled with the influence of lifestyle factors on your range of motion. If you're losing range of motion due to an activity, then it's probably more in your favor to be proactive and do this specific directional preference exercise on a more regular basis to keep your range of motion full and pain-free. For other people, it becomes something they are fine with doing reactively. Like, Laura, I don't want to mess with doing this neck exercise every day, but I know what to do if that pain comes about, or I know what to do if the stiffness returns. And that's perfectly fine. We all have different goals in our lives and different energy levels and things that we have to deal with, and most of our lives are quite full and busy. So being reactive is a fine approach. I just want people to be reactive when it's mild and not let it get to the point where it's severe. So for example, I've had major low back joint derangements, and for me, it's important to be proactive. I spend a few minutes every day on the mobility of my low back to keep it healthy, mobile, and pain-free so that I may participate in exercises and life the way I want to. Even if I get stiff and it's not that painful, it can prevent me from doing the things I want to do in the gym, for example. So I choose to be proactive when it comes to my low back, and part of that, I believe, is in part due to the fact that I've had many of the same joint derangements in my low back in my 20s and 30s, and it was there for a very long time. So I think that can lend itself to being a little bit more vulnerable in nature over our lifetimes. But I once had a shoulder derangement that was painful and limited in range of motion and easily fixable, and I don't think about that. I don't do any specific directional preference exercises for my shoulder. I'm happy with being reactive. If my shoulder starts to bug me, I know what to do to keep it good. So for joint derangements, we can present this spectrum of a maintenance program. Obviously, if the joint derangement came about because of a trauma, then the maintenance program could be like, well, don't get another car accident again, or don't trip off a curb again. And that's not the standard patient. The standard patient scenario is not having a trauma, but having something over time create that imbalance in the joint and therefore present with, range of motion difficulties and symptoms that are local or referred from the joint. So think of this as a spectrum for maintenance. And I want to present to patients after discharge that if your diagnosis was a joint derangement, there is a different ways to approach keeping it good in the future. But we usually can think about one, movement in this specific direction that was helpful in terms of the treatment strategy, and two, any lifestyle factors that may contribute to the return of that joint problem.